Hello, my name is Tess Greinock. I am a research data and scholarly communications librarian at Lamar Studer Library here at UMass Chan. Happy that you all could join me today for today's seminar on health data highlights of ICPSR. So stay tuned for the end of the session because there will be prizes. Um, so by the end of the session, though, I do hope that you will understand the types of health data available in ICPSR, be able to search ICPSR for relevant data, and create an ICPSR Researcher Passport account, and differentiate between the different paths to depositing data in ICPSR. So first off, what is ICPSR? So it is the University Consortium for Political and Social Research, and it's one of the world's oldest and largest social and behavioral science data archives, established in 1962. That same year, the IBM 3640 mainframe computer, pictured on the left, mainframe computer was installed in the Institute for Social Research, and I Can't Stop Loving You was released and hit #2 on the Billboard charts of that year. One of the 3 songs for Ray Charles that year, actually. And we listened to actually the #1 song on the Billboard charts, Stranger on the Shore by Acker Bilk, at the beginning of the session. So yes, ICPSR just celebrated its 60th anniversary, and it covers data everywhere from 1194 to the present. And primarily survey and other raw data types are what it has inside. And it also contains public documentation to help understand the data, as well as publications based on the data. It is based at the University of Michigan in the Institute of Social Research there. And it's a membership supported organization with over 780 member institutions as of June 2022, including UMass Chan. ICPSR contains over 10,800 studies and 83,400 data sets. And a good portion of that data is available to members only. So that's a good reason for, and one of the reasons why we subscribe to them and support them. And ICPSR is made of several data collections. Data that is deposited into ICPSR first goes through a cleaning, processing, and metadata addition, and then measures to improve dissemination and preservation, such as converting the data to multiple formats, before it's made discoverable in the data catalog, which we are going to be delving into. Some of the things that you'll not find in ICPSR, though, are quick answers to Google type questions, such as what is the population of Worcester, identifiable information about individuals or organizations. You won't find any pure genetics, physics, engineering, or other sort of natural science data. And you won't find any data to use in GIS or other mapping packages. There is data about locations, though, which we will be getting into a little bit later, specifically one of the collections that I'm going to be mentioning. So how do you find data? So there's sort of 3 main ways that you can do this. One is through the search bar that is available throughout the ICPSR website. The second is through the Find Data dropdown. There are several options to search for data. And then finally is the browse option. And since it's Heart Health Month, we are going to do a search for heart. And in particular, I would encourage you to filter by health after you've performed that search. I'm going to drop a link in the chat for ICPSR to get you started. So once you have finished that search, when you follow that link, you'll come to this page, do search for heart, and then on the left-hand side is the filters where you can filter for health. Now, I have a little quick poll for everyone to guide you through some of the other filters that are available on the search page. Awesome. I'm going to go ahead and end that, and I'll go through the responses. All right. So the first question was about what is the most common data format in the search results? And it looks like you both found that filter great. So yes, both I would have accepted SAS or SPSS are both correct answers in this case. They are the most common data sets for this search. And but you'll notice that there's a number of different data formats available uh, from uh, from other statistical packages as well, such as R and Stata, and a more sort of ubiquitous packages of delimited as well. So the second question was about what is predominant collection method? So in this case, yes, survey is correct. And the number of restricted data sets is 63. And it is hard for me to look at if the number of the correct responses, but I assume that you got it correct. And that was available under restriction type. So you can see that there are some restricted use data sets, and we're going to talk a little bit about how you would get access to those. The top thematic collection is located under thematic collection here. And the top one was our National Archive of Computerized Data on Aging, which may not have come as a surprise for a heart health topic. And earlier I had said how important it is for us to be members and have access to member available data, and how much of it is in this case. So in this case, under data availability, we see that actually most of it is public data. There's only a proportion that is member funded. And one other filter that I wanted to draw your attention to is the time method, which is further up here. And this gives you a sense of the type of study of when data was collected, whether it was all at once or across a long period of time. You can filter by that as well. And also within the search, you can also use Boolean operators as well. So if you you can combine using and, or if you want to remove words from your search, or even if you want to remove a collection, for example, maybe I want to remove all data that comes from OpenIPSR, I can just put a minus sign before Open ICPSR, and that will remove all the results from Open ICPSR, which is just one result in this case. All right. Any questions about that before we move on? Awesome. So each of those search results that you saw links to a record page. And there's a few things that I wanted to point out on this record page that may be of interest. So the first of which is the summary that comes up first. This will give you a nice description of what the data set and the study is about. And it also provides further down information about the scope. So the time period that is being covered by this data, as well as methodology used, and if there's any multiple versions as well. If you go along the top here, you get to the data and documentation where you can access only a subset of the data if you wish to download only certain files, as well as the documentation as well. And you can also go to the variables tab to look to see if the data contains the variables that you're interested in. And finally, the last part I wanted to point out is this data related publications. And this is where you can find any publications that were came out of this study. And you can see on the right hand side here that there were 23 of them. So there might be information about how different people have used this data that might be useful for your own research project. one thing new to ICPSR is this Explore Data feature. And so whenever you have a public study that is available in our format, it'll have this Explore Data button available. And that allows you to, as the button suggests, explore the data in 3 ways. One is through this snapshot view, so you can see a subset of the data. The second is being able to view the variables and getting a summary of each of the selected variables that you're interested in. And you can also compare and cross-analyze 2 variables against one another so that you can make sure, I have in this example here, that if you're interested in people whose mother had high blood pressure, and also have high blood pressure themselves, you can check to make sure that there's enough participants in this data set that cover those data points that you're interested in. So another way that you can explore the data is through thematic collections. And I've pulled together here some of the thematic collections that have health data in them. And I just wanted to go through some of them. So starting from the top, we have our Archive of Data on Disability to Enable Policy, or ADDEP, which has disability and rehabilitation data. The Child and Family Data Archive has data on early care, education, and families. Data sharing for demographic research has mother and child health, health disparities, and human life cycle data. The Health and Medical Care Archive is the data collected with funds from the Robert Wood Johnson Foundation. The National Neighborhood Data Archive has spatially referenced data measuring the physical and social environment in the United States. Land use, healthcare, recreation centers, and so lots of social determinants of health and environmental health factors included there. Some of the other ones are the National Archive of Computerized Data on Aging, which we've already mentioned, the National Addiction and HIV Data Archive Program, the Patient-Centered Outcomes Data Repository, which has clinical data from PCORI programs, the Resource Center for Minority Data, and then there's a couple of COVID-19 data repositories. One is part of the Open ICPSR, which is the COVID-19 data repository. And it's a repository for COVID-19 data sets, whereas the SBECCC, or Social, Behavioral, and Economic COVID Coordinating Center, has COVID-19 data sets. However, it is the one of the most useful aspects of it is that it streamlines information and data sharing between consortium members and has standardized questions and fields for researchers to use. And I've highlighted a number of the thematic collections here, but most of the collections have some health data in them. So I'd encourage you, if you're interested in data, to explore the different thematic collections to have a look in them. So another way to search that is available through that Find Data dropdown is the Search Compare Variables. And it enables you to be able to pull variables from across different data sets and studies to be able to compare them against one another. For example, looking at how different studies have done diastolic blood pressure, for example. And this is useful not only for finding data, but also for creating questions yourself and looking at how other researchers have created their own questions for data collection. So now, having learned some of the different ways that we can look at records and perform searching, I'm now going to turn it over to you for 5 minutes to search for your own topic of interest within ICPSR. And if you have any questions, feel free to let me know. We just had a great question come in about how to search in a particular data collection. So if you're interested in searching a thematic data collection, under the Find Data dropdown, you'll see thematic data collections listed, and you'll want to go to the Explore Our Data Collections by topic. And this is where you'll find the full list of all the thematic collections that they have and be able to search from there. Another great question came in. How is the information on data-related publications collected? Does ICPSR maintain that publication information for all data sets? So for how the information on data-related publications is collected, the staff at ICPSR has a team of librarians that performs searches of literature databases looking for references to ICPSR data, both through alerts that they have set up for themselves, and then they review what comes back, and so they do maintain that publication for information for all curated data sets. I know for sure. I'm not sure if they do for OpenICPSR, but I can check that out. Good question. And if you're curious about seeing their full bibliography, that can also be found under, if you go to data-related publications under Find Data, then you can view their full bibliography, and they often do highlights through their current events in the bib. So there's always great literature and publications also coming out about ICPSR data. Another great question just came in. So within the search results, I'll go back to our heart search that we were doing. There are a number of different sorting functions that you can do. So right now it's currently set to sort by study relevance, but you can also change it to alphabetically by the study title, or when it was released or updated, as well as the time period being covered by that data, and also the number of citations and publications that are coming out of the ICPSR bibliography for sort options. I forgot to mention too that along the top here, within the search results, the automatic selection is that you're searching, it automatically assumes that you're searching by study. However, you can also change the search results to look at the number of variables that mention heart, the series, data-related publications, or the entire ICPSR website for any website content as well. And while you're searching, if you do need some extra information about the data sets to make it easier to look them all at once, you can also turn on the summaries as well, and that will give you more information at a glance. All right, well, I'm going to go ahead and move on to our next topic of how you would download the data once you have found it. So there is 3 different ways that you can do 3 steps to this for public or member-only data. The first step is that you're going to need to log into your account. Currently, it is now called the Researcher Passport. Previously, if you had an account with ICPSR, it was the My Data account. So note of that new change. And so once you have logged in, you can either select the data set from the data documentation tab that you want to download, or you can download all the public use files at once. And the final step is to agree to terms and conditions that will appear in a pop-up window. And then your download should start. So I'm going to give you a minute now. If you would like to go ahead and create an account, feel free to do so. And I keep in mind that they have just instituted this research data passport. So we have not as of yet connected it to our institutional login, but hopefully that will be done soon. So for right now, if you are signing up for the first time, you will want to use your email to sign in and create an account, or use one of the other sign-in options. And once you are ready to move forward, if you can click on the green check mark in your reactions, that would be great. So to get to this page, you're going to want to click on the login in the top right-hand corner. Hello, welcome. We are just creating accounts in ICPSR. If you are, which is the first step to get access to any data in ICPSR, I will drop a link in the chat to ICPSR if you're interested in creating an account. All right. So we already talked about how you would access the member and only data as well as publicly available data. You log into your account and then choose the data you want to download, whether it's everything or just select data sets, and then agree to the terms and conditions. When it comes to accessing restricted data, it's a little bit more involved. So the main step is that you're going to need to submit an application, and on the any data set that has restricted data on it, there is a apply for restricted data or access restricted data rather button that's in the right hand corner or right side, and then you will get this pop-up window that appears to be able to start your application. And as part of that application process, you're going to need the project description and team members' names and information, IRB approval or exemption, a signed restricted data use agreement, and that needs to be signed by the institutional authority. In this case, it's going to be Bridge who's going to be signing it. So if you need to get that signed, you are going to want to reach out to the new ventures team at Bridge. Just confirming that. And the last piece of that application is a data security plan. And not only is there restricted data contained within ICPSR, but they've also been contracted to provide a service to be able called Research Data Gov to provide access to government microdata from government agencies. And so this is levels of data smaller than census tract or small other small populations. Which is usually restricted, and previously there was no central process for this, and now there is called Research Data Gov. And once you have your researcher data passport, it's the same account that you can use for this as well. All right, so we've talked a lot about how you would find data. And then the second part of accessing and using ICPSR is the ability to deposit data. And there's sort of two main routes for depositing data: curated collections and open ICPSR. So within curated collections, they provide professional curation. So that is everything from turning your data into multiple file formats for easy use, standardized documentation, and making it more findable in their database, or maybe putting it in a particular thematic collection. They also provide a DOI upon publication of the data set, and you can track usage of it through their statistics, and they will also do that searching of the literature for you to find related articles to add to the bibliography. Something to keep in mind is that from deposit of the data to when it's published does take time because of all those that work that's going into making that data better. And you do need to provide funding to be part of a funded collection or to be open to all. Otherwise, it's available to ICPSR members only. So keeping in mind if, for example, you are funded by the NIH and the requirements are that your data is as widely available as possible, you would want to try and budget for the curation of your data to be able to make it public if possible. And for that, you will want to give at least 10 days for that cost estimate, as well as the ICPSR is willing to review data sharing portions of NIH data management sharing plans. So the other deposit route is open ICPSR. For this collection, there's no fee to deposit, and anybody can submit their data into open ICPSR. The metadata record and supplemental documents and alternative file formats, that's all has to be provided by you as a depositor if you're depositing. And however, it does still provide that immediate DOI, and it is findable and by searching ICPSR. And you also get those usage metrics as well from anything you deposit in open ICPSR. So I mentioned before that ICPSR does provide some resources and support for NIH-funded data, and they have a full list of links available to them. And that is available underneath. If you're on their page, it's going to be under I want to say under data management. Yes, under share data for share NIH data. And there you'll have their full links and resources. And they also include language that you can include in your NIH data management sharing plan, which is available through this template that you see here. Everything that is highlighted in yellow in that template is language from ICPSR that you can include into your data management sharing plan if you're planning to use ICPSR as your repository for your data. And if that's not all, another great piece of ICPSR membership is that you get discounted tuition for ICPSR's summer program. And there are also scholarships available, and that deadline is fast approaching on February 26th. The registration does open tomorrow, February 7th, and it includes both in-person and online courses on quantitative methods. So if this is of interest to you, I'd encourage you to apply and register for a scholarship. And ICPSR also holds events throughout the year talking about their various collections or specific collection methodologies. And since next week is Love Data Week, they do have a full lineup of events happening. And if you're interested in that, I encourage you to look that up. And I will drop a link to the chat afterwards. And if you have any questions, feel free to reach out to me as your designated representative for ICPSR at UMass Chan, or reach out to our official representative, Sally Gore.